Good morning. Welcome back to the channel. This is Dr. Walker from Denwalker.com. I just thought I'd talk a little about just an overview again of a couple of things. Vitamin D and zinc and quercetin and those kinds of things. I just and happy to say I have been talking about this combination of things for probably now 2 years easily, and happy to say that I had a COVID antibody test a couple of days ago, and very happy to see that I have COVID antibodies to COVID-19. I have IgG and IgM, and I took a kit home and I gave it to my wife, and she also has antibodies to COVID-19. And what's impressive really was, again, it was just one of those things. I said, let me, because I tried it before, took the test before, and I got, it was negative. And so twice before, in fact, over the last year. And so this is my first one that I took, and it was clearly positive, and I posted it on Twitter at Dr. Denwalker. I posted it a couple days ago, and just really happy with it. Happy with the fact that I apparently had COVID some time ago, and I tell you, I had absolutely zero symptoms. None of the typical conventional things that people talk about: headache, loss of appetite, belly pain, diarrhea, cough, sore throat. None of that. I had none of that stuff. But for me, I'm taking 10,000 units of vitamin D, D3 specifically. And again, lots of discussion about why 10,000 for dark skinned people. It's more difficult to convert that inactive to active form of vitamin D in us. And if you're not outside between, some people would say 10 a.m. to sort of 3 p.m. when the sun sort of is highest in the sky and the angle is just perfect with the earth, that you're not going to get that amount of vitamin D that you need to do well. So I take 10,000 units again for dark skinned people, and again, obviously get your levels checked. Don't take my word for it. Just get your levels checked. Start if you want to start at higher doses. Again, for dark skinned people, higher doses, and then check your levels and see where the levels are, and then go up or down from that. That would be a good thing to do as well. But again, get your levels checked. And I'll try to post a link to the article that I reference regarding how much vitamin D to take. But remember, COVID-19, very, very interesting virus in that it is able to take cells, specifically some of the cells it gets in contact with, sort of, and involute those receptors. So those receptors become dysfunctional. So the other hormones that typically engage in those receptors are defective, right? So vitamin D is alleged to sort of either replace those or right size them, if you would, get them back to a normal state, which means then that the typical function of vitamin D and other things can actually activate or get on those receptors and do what they need to do. So that's one of the great things about vitamin D. It's also great anti-inflammatory, and it reduces the cytokine storm, which is the thing that causes a lot of folks to get that fluid buildup in their lungs, and then they can't breathe and so forth. So just, and it's best to stay ahead of the curve, if you would, on the vitamin D spectrum, because you don't want to get behind on vitamin D and then try to, quote, to catch up. And again, if those receptors are sort of inverted, they're not functional for you. They're not helping you. So get ahead of that. Then the other one really is the quercetin and zinc combination. That zinc being sort of the inhibitor of viral replication, but it needs to be transported across the cell membrane, because zinc by itself, if it's extracellular, so outside the cell, it doesn't really do a whole lot for you. So it has to get inside the cell, and the thing that does that transport of it is any of those ionophores. And the one that I use is quercetin, because you can't get the other two easily. Some people can, but the easiest one to get to, the over-the-counter one that you can get to, would be the quercetin. Ivermectin and hydroxychloroquine is very difficult for some people to get to those, but and again, some issues about some people with complications from them. If and when you have ivermectin, you can see my other video on ivermectin. I don't think it's been removed yet from the site, from YouTube. But the simplest one to use and get to is the quercetin and the zinc combination. Dr. Zelenko has his profile in terms of how much zinc to take, about 50 milligrams of zinc to take. Some people would say even 30 would be fine. But again, as long as you're taking something to help you, that would be wonderful. Vitamin C also is another thing to consider, and it's vitamin C is important because it also helps to help the functionality of different cellular functions going forward. So in other words, it's a great adjunct to a lot of cellular function. And 1,000 to 2,000 milligrams is what most people would say. Probably upper limits of normal again being 2,000 for most people before you start having some belly problems, and usually that's the big complication with too much vitamin C. You may get a little diarrhea. So if you do get diarrhea with it, then you sort of back off from 2,000, maybe start doing just 1,000 thereabouts. The last thing I was going to say is this: there isn't, and I really can't find a whole lot of information regarding the duration or how long you should take a quercetin for, which means that most people will tell you 3 months and 4 months, but people have been taking it for years, and I've been taking it for 2 years at least, and I've had no issues. So I think one thing to consider definitely is if you've had COVID in the past, and you're certain you've had COVID, you had a COVID positive test, and better yet, if you have antibodies, then you could consider either switching to quercetin, perhaps weekdays and perhaps taking weekends off, or maybe alternating from to every other day thereabouts, just to sort of be on the safe side. Some people that could have some problem with quercetin would be people that have hypothyroidism, one, and there's some discussion that it could also affect how thin your blood becomes, especially if you're taking things like Coumadin and those kind of things. So just be careful from that standpoint. So maybe alternate, the quercetin maybe every other day, or maybe just take weekends off, if you would, just to see how you do. If you're taking it just as an allergy med, it actually works very well as an allergy med as well. So if you're taking like Zyrtec or one of those allergy meds, and you need it from that standpoint, then continue doing that. But if you're taking it just as an ionophore to get the zinc into the cell, just consider perhaps having a break every now and then, just to be on the safe side, because long-term safety data has not been completely looked at yet. But again, I suspect it's just like anything else. High doses or lots of onions, also cherries also have very good ionophore effects, if you would. So you could try that. But again, just consider that as an alternative. Anyway, I'm happy again that I now have antibodies. So, but I'll continue my regimen, probably again taking weekends off or alternating my quercetin. But my zinc I'll keep the same. My vitamin D again, because vitamin D is such a cross-functional supplement that and some people actually call it hormone. That I will not sort of throttle back on that. I'll leave my vitamin D levels the same and maybe alternate the other ones. Anyway, thanks for listening, Dr. Walker.